Hello, everyone. Good morning from us from Sacramento, California. And I'm sure some of you guys are not in the time zone, Pacific time zone. So good afternoon for rest of you. I'm still waiting for all the participants to join us. But I'd like to welcome everyone to our monthly weight loss surgery webinar for Mexico Bariatric Center. We're just gonna wait a couple more minutes. Meanwhile, please go ahead and make sure that you have health questionnaire in our system. And if you have submitted one recently, you don't have to submit one. If you have not submitted a health questionnaire, go ahead and go to mexicobariatriccenter.com and go to the health-questionnaire and select Dr. Miguel Montalvo for your surgeon. And the way the raffle for $2,000 off surgery work is of our surgery package is you need to have a HQ in our system to be eligible for the operation or procedures that Dr. Montalvo offers. And in the in the middle of our presentation, we will send you a Zoom poll, and you need to fill that out and be present to the end of the webinar. And we will do the raffle at the end of the webinar after the Q&A. We are expecting usually about 1.5 hours. Sometimes it goes closer to 2. If the Q&A, the question and answers are not complete, you're welcome to come back, call us or email us for your questions. But please pay attention because we would try to answer the most asked questions while we're doing the presentation. And I'm also waiting for Dr. Montalvo to join. Let me see where he's at. Okay, so he's joining in a few seconds, no problem. Okay, so my name is Ron Ellie. I am the director and founder of Mexico Bariatric Center. And Dr. Montalvo, which he is going to hopefully join us shortly. He's one of our surgeons joining us from Tijuana, Mexico. We do our webinars the first week of every month, unless there is like a Super Bowl or some kind of event like a July 4th that we push it to the second week of the month. So, but this is the one that is normal, first week of the month. Again, for the ones that are joining, please make sure you have a health questionnaire in our system and pay attention when I send the Zoom poll. You need to do that. And we would do the webinar raffle for $2,000 off a package, surgery package at the end of the presentation. I see Dr. Montalvo is trying to join. Again, we try to answer all the questions that we feel are most common. And if we don't hear it, of course, you're welcome to ask us in the Q&A tab. The subjects that we are offering today or we're discussing today is about obesity, risks of being obese, weight loss surgery, MBC, Mexico Bariatric Center. What is it that we do? Why MBC? And then Dr. Montalvo is going to explain all the procedures we offer from laparoscopic to endoscopic and all the options, revisional, difficult, complex surgeries, And then you will see why MBC right there. Uh, and then we touch on the importance of bariatric specific vitamin, multivitamins, and we'll talk about emerge. And then we open up the Q&A. Somewhere before Q&A, I would send you guys a Zoom poll. Please go ahead and fill that out. That's a requirement for you to be entered in the $2,000 surgery raffle. We all know what obesity is. Basically, Dr. Montalvo, hello, good morning. I see your picture now. Okay, so I guess you're still on mute. Anyway, obesity is a chronic disease, is a multifactorial metabolic disease, and it's affecting population worldwide. And the problem is, you know, the modern conveniences, lack of physical activity, and the nutrient content of the food that we have access to, the calories, the sugary drinks, the ultra processed foods. Those are all contributing to this problem. And in the medical field, they have a formula that they count your weight and height, and you see by figuring out what number your BMI, your body mass index is, you get to be in this chart here somewhere from normal, which is less than 25, to overweight, which is 25 to 30, and after 30 is considered obese, and then is morbidly obese and super morbidly obese and super morbidly obese. One thing about our center is we have no limit of what we can handle as far as BMI. We've done BMIs of over 110 in our center. So that's something we have no limitation. Of course, you know, you need to do a good pre-op diet, but we can handle that. Again, you know, the factors that I just mentioned, you know, genetics, your lack of physical activity, inadequate sleep, that's another big one. Some of the medication that we regularly take that can contribute to this problem too. And as Americans, we're used to these big meals, you know. So when we go to a restaurant, we expect to have a big, you know, dish big of food, full of food, and that's, you know, it's contributing to all that. So as a fact that when we gain weight, our fat cells or adipose tissues increase in numbers, increase in size, and not only increases in numbers and size, it increases and it changes its chemical properties. And if you look at the right of your screen, you see a comparison of an obese fat cell and a lean fat cell. You see how the chemical composition of the fat cells or adipose tissues change. This is causing all the problems like insensitivity to insulin, which is diabetes type 2, insensitivity to leptin, which we don't feel that satiety after meals. We don't respond well to therapies. We don't respond well even to the vaccination. And like even our muscles are insensitive to protein and exercise. And that's another big issue, right? So again, and it comes with multiple problems, medical problems, right? Major risk factor. Like in US alone, 40% of adults are dealing with this problem, with the obesity problem. I like to always show the this video animation about what happens when we gain weight, fat in our abdomen. Okay, so let's just watch this for a minute.
Consider this. Our diaphragm is one of the major muscles that helps with breathing. Breathe in, and the diaphragm contracts, and the lungs expand to take in oxygen. But if you're obese, fat in the abdomen can push on the diaphragm, limiting how much air you take in.
Very simple way to show what happens, at least in the lungs, right? So we talked about it, diabetes type 2, heart disease, stroke, lung disease, impairment to our immune system, chronic inflammation, you name it. And we learned during the pandemic that being overweight and obese is not a good thing because it exposes you to catch coronavirus and be hospitalized more than a lean person, and actually death because of obesity. And the reason, of course, again, there are more fat cells. The coronavirus likes to attach itself to the protein, which is a protein, to the fat cells. The more fat cells you have more chances of catching the disease. And then, so we know like the cure for obesity, right? Diet, of course, exercise, but we don't have a long-term success with diet and exercise. You can lose weight, but then you gain it, and you're going to see in a minute why, right? And from early on, we always looked for that magic pill, that magic injection that we just take or get a shot and lose weight. It's pretty close. You talk about Ozempic, but again, not a proven long-term solution for obesity. The proven, quick, safe, and long-term solution as of this time is weight loss surgery, which we call bariatrics. That's the long-term solution for obesity. Here's an explanation, very simple, what happens when you do the diet and exercise. When you do that, once you start taking less food and go on diet, your body reacts by increasing your hunger and decreasing your metabolism. There you go. It's like a hurdle to get you to your goal weight. And this is another explanation of what's the difference between diet and exercise and weight loss surgery. So what weight loss surgery or bariatrics does is it calibrates, it resets your metabolic system, okay? Our metabolic system, you can think of it like a thermostat. It's a body thermostat. Our brain, our hormones like ghrelin, all those hormones are interacting at a set point that the body is used to. And that's your metabolic system. So when you go on diet and exercise, well, diet and exercise is great. We're not saying don't do exercise, don't be active, don't eat well. But what we're saying is, let's say this person weighs 250, they do extreme diet and boot camp type of exercise, and they manage to lose 75 pounds, right? So they get to 175, but constantly the body wants to pull you back to the 250 because that's your metabolic thermostat. And what it does is, again, like the last slide we saw, your hunger goes up, your metabolism goes down. It doesn't burn fat, and it wants you to eat more. Now, what happens with bariatric surgery? Bariatric surgery not only give you the restriction, it also changes your hormones, okay? And by changing your hormones, it resets your metabolic system. Now your brain and your hormones are interacting at a different set point. Let's say this person, the minute you wake up from the surgery, your brain sees you at 175 pounds because your hormones are changed. And that's the magic. That is the magic. And that's what makes it quick, safe, and long-term. So we were talking about the magic pills and magic injections, right? Ozempic is a breakthrough, but then again, it is trying to, basically the pharmaceutical is trying to simulate all the hormones that are changed by bariatric surgery that you see on my right of my screen by a synthetic hormones. Okay, so one of them is ghrelin, right? The hunger hormones. Dr. Montalvo is going to explain what happens when you do sleep or bypass and all that, right? CCK, the GLP-1, right? GLP-1 is the one that Ozempic has. And Mounjaro has GLP-1 and GIP, but look, the bariatric surgery had GLP-1, GIP, PYY, amylin, all the gut peptides, all the fat hormones, the leptin, so many hormones that are changed as a result of the surgery, right? That are trying to simulate. But then again, you have to inject that constantly to simulate the effect of the bariatric surgery. So if you stop, you're gonna gain the weight. But when you do the surgery, it's naturally changing your hormones. And long-term effects of any medication is not good, has consequences, and Ozempic is not different. It's now they're finding you may go blind, so without any irreversible vision loss. All sort of cancers, including thyroid, pancreatic cancer, loss of muscle mass, you lose 60% more muscles than you would do by a regular diet. I mean, you read about it. There's so many things. And then if your kidney, now your kidney is going to be affected too. You may end up with CKD. So all that is effective. And not only that, now they have a shortage, so the price is high, so you end up paying a lot of money. And once you stop, you gain the weight back. Okay, so this pyramid, it shows what is the effectiveness of each tool that we have to lose weight, right? Diet and exercise. Long-term only works for 3 to 5% of the population. Semaglutide, which is Ozempic, Wegovy, Mounjaro, there are different brand names. They're all the same pretty much. And they're doing 5 to 10%. And then we have what we call endoscopic procedures, which is not a surgery, is more like restriction, like a gastric balloon, ESG, which we call them endo sleeve. And then this is the gold standard, which is the sleeve gastric bypass, VSG bypass, RNY bypass, DS, mini bypass, SADI, all those procedures are the one that work for the most of the population. Dr. Montalvo is going to go over that. Now, the problem with this surgery is because of the hospitalization, because of the instrumentation that they have to use is expensive. In US, if you were to pay cash, it's about $20,000 for VSG and more for bypass and DS. If they do hospitalize you, sometimes they do like a ambulatory, which they keep you minimum in the hospital to reduce the cost. But then again, you go home with bunch of risks of having blood clot and all that stuff, right? There's no nurse to take care of you, and this is not something that you want to do. But then if you want to save money, you can go through those, and it's a few $1,000s less. So what's the solution? Medical tourism. Medical tourism is going abroad to a different country to get a procedure that is not available to you or is expensive at where you are. Or in case of Canadians, for example, it's free to them, but they have to wait sometimes depends on the provinces that they are in. There could be 3, 5, 10 years. And now, when you go to medical tourism, it's very important to go with a reputable, solid company like Mexico Bariatric Center. You know their track record. They do all the coordination for you, from the transportation, all the hospital surgery stay, all that is coordinated and arranged for you. You don't have to make a guess. That you have a peace of mind from the time you get picked up to the time you get dropped off. Go read the CDC guideline for medical tourism, and you see what is their recommendation. Recommendation is find a company like MBC. Do your research, find the one that provides the peace of mind with the surgeons that are not assistant surgeon, they're not inexperienced, they are young, and they have ton of surgeries behind them. MBC has been in business since 2012, over 12 years, doing the same thing. Look at our reviews on Google, Facebook, the medical care we provide, the way we treat you when you go down there. This is something is popping up more and more, okay? And you're going to see later on why, because we're going to provide you with a list of the procedures that we are capable to offer and what the competition is capable of offering, okay? And now that there are more and more bariatric surgeons in Tijuana, in Mexico, and what they're trying to do is they go either create a company by themselves or they join another company, but they just came by assisting another surgeon, or they just went through a course from one of the hospitals, got some training, but they have no experience. And this is something you want to very carefully look at and research. Who is the surgeon you're doing the surgery with? And it's not just the lack of experience. There are two problems with that. First of all, the lack of experience, I always compare that with the pilots. If you have a pilot that has only maybe a few hundred or few thousand hours behind them, there is a difference when they get to turbulence, when they get to the difficult situations, than somebody who has 50,000 hours of flight time. This is very important. Yeah, a lot of times there is no turbulence, there is no situation, but once in a while there is. And you're risking your life by not having that experienced surgeon. I was just flying back from my trip to Tijuana back to Sacramento the other day, and so the pilots took the plane 2 times in the runway, and he was a very experienced pilot, you could tell, and he had an assistant, but he decided after 2 times of going to the runway not to fly with that plane. It was a 4-hour delay, but I appreciated that because I didn't want my name to end up in the news. So this is what you get with the experienced pilot. And you know what he said? He said, I don't want to fly with this plane. I know there's going to be a problem in the midway. Okay, so look at the experience of the surgeon. I highly recommend that. Now, another problem with these single surgeons that just start a company and they think that they can do all that is because of their limited skills and limited expertise, limited specialization, they are not going to be able to provide the procedure that really is good for you. Let's say if you have to get a bypass or DS because of your health condition or whatever, we're going to see the differences. They're going to convince you to go with a gastric sleeve. And you're getting a procedure that is not good for you. And you're going to suffer for the rest of your life. And so plastic surgery, I always say that plastic surgery is something that you can see visibly is there, is visible, is visual. If a surgeon messes up a breast implant or breast lift or tummy tuck, it's too obvious, right? But if you get a procedure internally, you're going to suffer for the rest of your life. And it's not visible to you, but you'll be suffering, right? So go with an experienced surgeon, go with a company that can offer, that you're going to see the list of the procedures that we offer. And take a look at these single surgeon companies that they think they're advertising like us, they think they're us, but they're not. Okay, so there are so many reasons to choose MBC. And our prices are the most competitive, but also not only that, you get all these differences with us. We've been around, you can come back and ask for some document, some invoice, whatever the case is, ask for help with your nutrition. We are around. We do your FMLA paperwork. You know something else I say? Here I am. I'm the director. I'm running this company. You see who is behind the whole company. Is not some unknown name. Just it's very obvious. You get these companies. We talk about this in this here, social media, the website, the Google advertising. Anybody can go pay Google and show up #1 in the Google when you look for keywords and be #1. Who is behind the company? Who is the website behind it? Okay, it's easy to get a 1 or 2, 5 before after pictures, maybe buy it or just have it from here and there, maybe Photoshop it, put a TikTok up, put a cute little video up there. But who is behind all that? What is their credentials? You know, it was funny. One of the websites just popped up the other day, and we were trying to see who it was because they were asking us to price match. The surgeon says in the website, I am the second surgeon in Mexico Bariatric Center. So we were looking around. We don't have this surgeon in our team. So what it turned out, he just took off from being an assistant surgeon to one of our surgeons. And he said it the right way. He's a second surgeon. Yeah, he was the assistant surgeon, not to NBC, to the surgeon from NBC. You see how you can manipulate with words and names and do all that. And then they go down to low prices because they're desperate, right? They're desperate. They're trying to get to this business, but you're risking your life. With the prices that we offer, you should look nowhere else because there is no sense of doing this by saving 200 or something. I don't know. We are a US-based corporation. Our commitment has been from day one to patient safety, quality, and offering best prices for what we offer is another effort. We've been looking at building a surgery center standards that exceed or meet international US, Canada standards. Here's the project I've been working on since 2021 with the best architect, with the best medical directors, with best staff in Mexico. And this is about to come online anytime. And it's going to be a game changer. And you will see the technology that is offered here, the conveniences, the aesthetics is above any competition that we have down there. Okay, so we did talk about this already. We have 12 years in the business. I myself started medical tourism in 2007. So I've been in this business, not under Mexico Bariatric Center, for 17 years. We've done over 25,000 successful surgeries, and we have the top 5 surgeons. The other day, actually, I heard from another hospital that they said NBC surgeons are different. This is in Tijuana. Our processes are very streamlined. You fill out a health questionnaire, you get your approval, you can actually go online and find a spot that matches your calendar, your opening, your convenience to pay the deposit and get booked. If not, our coordinators are around to book you, and you book your flight, or you driving. If you're driving, you would arrange for your driving, you fill out the paperwork, and you're done. Support is huge because the bariatric surgery is a tool that is given to you, but now you have to do your activities, be active, be watching your diet, and change your lifestyle. And the support group is what you need. Our main group has over 12,500 past patients. And we have so many Facebook groups that you can join based on your interest. Our past patients that are supporting us, Sarita has been with us probably from 2015. She's very active on Facebook. Rena, Dawn, Kelly, Jamie. Actually, we will have Jamie join us today to talk about her experience, her success from what I need to, let's see if we can find Jamie. There you go. I hope you're around, Jamie. I'm gonna let you talk and
I'm here. Hi, Ron.
Yeah, I can actually, we can even see your picture if you have your video on.
I do have my video on, I think. Let me see what's going on here. Um, Yeah, for some reason it's not letting me.
Oops.
It's okay, but I'm here. I think Vivi put together a slide too. Anyways, my name is Jamie. I'm a patient coordinator here, and Dr. Montalvo is my doctor. So I got a special place for him. I love all of our doctors, by the way, but he changed my life, and I lost 210 pounds in 2 years. My surgery was February 10th, 2022, right after COVID. And I thought that the process myself was too good to be true, honestly. And I had some friends that went, but I was tired of what was happening in the States with my surgery here. And because of COVID, they shut down all elective surgeries. So I kind of didn't have a way out at that point, and I kind of was already working their program. And so I felt like I needed to make a move. And my girlfriend said, "Hey, I'm going to Mexico." And I was really jealous. And I was like, "No way. I've been like working so hard with the States and now I'm at a dead end." So I said, "I'm going too." And I I called, and Laylee was my coordinator. I don't know if you guys have heard her name around, but she works in the office and she was my coordinator. And now I get to work beside her every day. It's really cool. And I was on a ton of medications. I had um, almost needed a knee replacement. I have fibromyalgia, rheumatoid arthritis. So those of you out there that struggle with those kind of ailments, it's difficult when you're carrying this kind of weight. So you've got to make a change. I literally do circles around my 15-year-old son. I can chase him down and keep up with him, and he's very athletic. And I don't get out of breath. I really enjoy. Um, my new lifestyle. Your whole life is going to change. Your attitude starts first. And with your pre-op diet, you're going to lose some weight right before you get there, just by nature of the way that the pre-op diet is designed. And it's helping you to set up for your tool later. And being 2 years out and going into my third year, and I would just basically say that I have restrictive stomach still, like I have restriction there, and I just am very mindful of what I eat and put in my body now. And I never thought, so for those of you who don't, can't wrap your mind around this diet and how you're going to quit eating this and stop that and doing this, it's the way that their pre-op diet is designed. It's there to set you up for that post-op surgery. And I didn't think I could do it either, because sometimes my first meal of the day was 3 o'clock in the afternoon. I'm just so busy. I'm not hungry in the morning. I'm not a breakfast person. Um, and I would just get up and go. And then I'm like, geez, I haven't eaten and it's 3 o'clock. That's bad for your metabolism. This surgery changes your whole metabolism out. You like it resets your whole metabolism, and it's a game changer, let me tell you, because while you're working, eating healthier and having better changes, that metabolism has kicked in. It also takes out the ghrelin hormone. I'm sure Ron and Dr. Montalvo will get into that later, but it also stops the cravings. So you're when you start eating healthy too and creating those healthy habits, you start craving healthier options. Um, I'm now obviously a patient coordinator here at Mexico Bariatric Center. In October, it'll be a full year that I've been here. And I decided to work for this company for a couple reasons. I own my own salon, and I'm recently selling that to pursue my career with Mexico Bariatric Center, because I actually love it so much. And they've helped me. They still guide me. Even though I work for this company, I still get guidance from our nutritionist. They're just so helpful along the way of every process and everything you need. But I really work for this company because I did my research before I came here, and it's the place that I felt the most comfortable. And I finally, something worked for me, and they helped me achieve that. And Dr. Montalvo is an amazing person. He is very sweet and nice and friendly and easy to talk to and get your questions answered by him. But most importantly, again, I have a partial place for Dr. Montalvo because he is my surgeon. And again, all the surgeons are phenomenal here and they're very sweet and nice. And we try to pair you with somebody that would be a good connection or a good fit for you as well. But I do have a special place for everyone here. And if I had to do it again, I wouldn't have waited the 2 years to start this process. If you're thinking about it today, do it today because you don't have maybe tomorrow. I was in such fear that I was going to drop of a heart attack because I just could not get the weight off. I was walking like 6 miles a day and could not take the weight off. So, those of you who are struggling there and eating like a rabbit, that's not what it's about. You get to eat real food on this diet. You're not giving up things, you're giving up unhealthy habits. So, just keep that in mind. And I'm always here. All of our patient coordinators are here to help you and assist you in anything you need. We have a full staff that can answer pretty much any question you have. And Ron, I don't know if you or Dr. Montalvo have any questions for me.
No, thank you so much for taking time joining us. We appreciate you.
I appreciate you guys so much too. And thank you again for allowing me to be a part of this big, big movement. And, those of you who are, again, considering surgery or already have surgery booked or who have had surgery, we are all in this together. And I just don't leave anybody behind. And I want to take you all with you with me on this journey. I'm still on one. And I want to say this too, after 2 years, almost three, I'm still losing inches. So it doesn't just stop. You still have a way, there's still things that are moving parts with this surgery. So, just because I'm 2 years out doesn't mean I'm just done with this journey. I'm still on it, and I hope you're all here for it. And I hope you all have a wonderful weekend. Call me if you need anything at all.
Well, congratulations for your success. This is huge, life-changing experience that you have gone through, and you're trying to help other people to do it. We
It
appreciate
feels
it.
good. It feels
Okay.
really good to help everybody too. So, I enjoy this job a lot. I appreciate you.
Thank you. We'll talk later.
Have a
Um,
great day.
you too. Okay, thank you. So, Rena and Sarita actually doing some podcast for us, and you may want to tune into those. Basically, our your journey is very simple. You again, once you're on the calendar, you can book your flight or your if you're driving, arrange for your drive, how to get in and out. So we will pick up everybody from San Diego International Airport. So even if you drive, you can come to San Diego International Airport, park in the parking lot there, and we go to the airport and we pick you up. We like you to come to arrive before noon. That gives us enough time to do your pre-op and get your set up in the hotel. And if for departure, 2 p.m. is a good time. Just remember on Sundays, if you're leaving Tijuana in Sunday, it could be a little hectic. Even with medical pass, it's hectic going out. So you may want to be mindful of that. And maybe if your departure is on Sunday, maybe go at 3 o'clock or a little later. Again, the network of the doctors that we have. And that's what makes us be able to offer all sort of different procedures, right? Dr. Miguel Montalvo, we call him Sleeve Master, by the way. And Dr. Gutierrez, he's our chief surgeon, double board certified. Again, I can say so many things about each one. Dr. Rodriguez Lopez, he's a super surgeon. Dr. Jacqueline Usuna, I worked with her since 2010. She is a very dedicated surgeon and very experienced. Dr. Jesus Seja, well respected in his field. So this is the process that we take your health questionnaires through. So it goes through a metal here that is a support layer in our side, which we call surgeon liaison. She's actually a physician that studied in US and Mexico, and she's bilingual. She's looking at every HQ going through with Dr. Montalvo, all those. So first of all, we match you with the best surgeon based on your BMI, your needs, different criteria that we have established over years of working, and then you get matched with the best surgeon, and the the surgeon liaison is monitoring all that. The pre-op is pretty straightforward. Basically, based on your BMI, you can do a 2-day clear liquid all the way to like 8 weeks. If your BMI is way up, like 80, 90, you really need to do a better job on the pre-op diet. The idea of pre-op diet is to shrink your liver and just give the surgeon more room to maneuver in your abdominal cavity. And, basically you go low carb, high protein diet, just maybe protein drinks and things like that, and just eat more like meals like with salad, fish, and chicken. We talked about that, how we always try to do the best we can as far as hospital facilities. And now that we're going to move to our new hospital, that's even going to be game changer. We use Hyatt Place for most of patients. If they run out of time, Hyatt is right now is the most in demand hotel in Tijuana. Believe it or not, sometimes they charge me rack rate at over $200 a night when I stay there. Unbelievable. So anyway, you get to stay there and enjoy the broth, the jello they give you, and companion stays there the first night with you, and then once you leave, they would stay behind. They would enjoy the breakfast. Their breakfast is awesome. I always go down at 6 and 7 o'clock to have their breakfast myself. And as far as medications, just make sure you pay attention to the information is sent to you as far as if you are taking medication on a regular basis, which one to stop or start again after surgery. Bring the bottles of the medication if you're taking some on a regular basis with you to Mexico. And as a general rule, don't take NSAIDs, Advil, blood thinners 1 week before surgery. We highly recommend stopping smoking because that's a huge part of the recovery. You have less chance of complication. You have better chance of not better, but easier recovery. So smoking is huge. On the day of pre-op, we basically just do your blood test, we do your EKG, we do your physical, and you be good to go. We take you to Hyatt or whatever hotel you're staying, and you would be ready for the next day. The surgery day, they tell you what time to show up, and we will take you meet the surgeon, and you get prepared for the surgery. You stay in the hospital based on your procedure. For balloon is 1 night, sleeve 2, bypass DS 3, and they do the leak test, all that stuff, pre-op, post-op. You be released after that to go back to San Diego. You have option to stay longer if you want, or go in San Diego side and stay longer. We have a contract, well, not a contract, special deal with Hampton Inn that if you mention the name of our company, Mexico Bariatric Center. They give you a special rate. That's a really nice place to stay because it's close to San Diego. You see the water and you can walk around. Very nice area. Now, so you fly home, make sure if your flight is too long, get up and walk around. Make sure you have compression socks on, all that stuff. One of the reasons you want to go with Mexico Bariatric Center. Our surgeons' load is managed day by day based on the complexity of each procedure they offer. We limit their load on a daily basis. And that's why our complication rate, that's one of the reasons our complication rates are less than 0.5%. Like, for example, Dr. Montalvo. Honestly, I have heard maybe one time that there was some kind of bleeding going on, that he pulled the patient. And this is after so many years. This is the only one I remember. So he's almost zero. Of course, if a surgeon tell you that their complication rate is zero, you want to run, because that's not the truth. But our complication rates are extremely low because of their experience. Okay, so we talked about inexperienced surgeon versus a team of experienced surgeon. Team of experienced surgeon can offer all the list that Dr. Montalvo is going to explain. Look at this. There is nothing that this center cannot accomplish. Now, go ask these low-cost advertising surgeons by themselves. Even the one that have a lot of experience, I'm not going to mention names, just go ask them, what are you capable of performing? Here's the thing. They may even sign you up for bypass, but once you get there, they convince you to get sleep. One of the problems with bypass is not very many surgeons can do it. And not only that, if your BMI is over 50, they're not going to be able to do it. But there is no limitation on a RNY bypass BMI for us. So this is what I'm talking about. Dr. Montalvo is going to explain to that. I'm going to talk about him just a little. You know, these are world-renowned surgeons. I don't need to explain so much like how great they are or what they do. I mean, he is academically, practically, he's one of our best surgeons. He's worked with us alone for so many years, and I bet he has over 5,000. These 4,500 probably is old statistics. I mean, his education, his training, his skills, his team of, you know, you have to remember, who is his assistant? Who is the anesthesiologist? Is your anesthesiologist a cardio anesthesiologist? Look at all this. That's why we can handle all these difficult cases, because of expertise of these teams. I mean, there's so many little details that you cannot just compare with price. Okay, Dr. Montalvo, I spoke too much. I'll let you take over and explain to us what's happening in our center. Thank you so much for taking time and doing that.
Hi, hello, good morning to everyone. Well, some of the laparoscopic surgeries options that we have all the options that exist. The gastric banding is not more in use, but is very important to mention. The gastric sleeve is one of the worldwide most surgeries performed. The mini gastric sleeve, the single incision sleeve, the RNY or the mini bypass, also called the OHEB, one anastomosis bypass. The duodenal switch, the single anastomosis duodenal switch, various laparoscopic gastric revision surgeries, and bypass reversal surgeries. And endoscopy, we also have the gastric balloon, the endoscopic sleeve gastrectomy, and the endoscopic bypass revision, or also called TOR. Okay, talking about the gastric sleeve surgery, the gastric sleeve surgery is the most worldwide performed surgery. I can also think it's like the maybe 85% of the surgeries in the worldwide. Here in this type of surgery, we remove like the 85% of the stomach using 1 to 5 tiny incisions. In this procedure, we utilize restriction to the limit food intake, change the gut hormone that causes hunger, anxiety, and slow gastric emptying. The expectations with this kind of surgery is decreased levels of ghrelin. This ghrelin hormone is also called the hunger hormone, and increase the levels of GLP-1, increase the levels of PYY, and there's no changes in the GIP. The pros is can be easily revised if needed in the future. A little percent of the patients can in the future can need a revision, and this is the most easily type of procedure if you have the sleeve in comparison with the RNY. Because this kind of surgery is a restrictive surgery, so in a revision we're going to try to convert this to a malabsorptive procedure. Other process, a high amount of excess weight loss comparable to the gastric bypass, the resolution of comorbidities like hypertension, cholesterol, diabetes, arthritis, PCOS. There's no changes in the anatomy, and there's less malabsorption and short recovery time. It will depend on what kind of activity you do. And the cons is can be worsened pre-existing acid reflux or GERD. And there's not reversible with because the stomach that we resect, we're going to remove of your abdominal cavity, so there's not going to exist anymore. The duration of this procedure is like 1 hour. You will need to stay at hospital 2 nights, and the recovery is from 1 to 3 weeks. The single incision gastric sleeve is the same procedure, but only with one scar or incision through the belly button. The operation is performed to one opening roughly 1.5 inches, while the umbilical or navel area is hiding inside the belly button, so the abdomen looks scar-free, and any drain tubes are removed. The expectations, this is the same result as the BSG, but without the incisions. The process is more aesthetic, it's faster recovery, and here the cons, your BMI need to be less than 40. And this more work because will be more work, so if you're all over 40. The duration approximately is 1.5 hours, that it will need 2 nights, and the recovery from 1 to 3 weeks. All right, here with the endoscopic gastric sleeve surgery, here the physician or the doctor will put a tube or a camera inside your mouth and go through your stomach. There, smaller stomach is performed by folding the stomach to create a banana-shaped tube. This procedure utilizes restriction to limit the patient can eat at a time. So here, the new stomach is going to be shrunk. The endoscopic physician is going to put some surgeries to make more small your stomach, but here the expectation is hold less food and decrease the food intake, the lower amount of excess of weight loss, no well suited for patient with gastrointestinal bleeding, a large hiatus hernia, or previous abdominal surgery. And then with talking about the gastric bypass. The gastric bypass forms a new stomach pouch while the remaining stomach stays in the place. The small intestines are rerouted to a bypass food digestion, which will create malabsorption and reduce the calorie intake. Here, the pouch will be like 10 or 15% of your stomach, okay? So here in on the bypass, we're going to exclude proximally is like 2 meters of your small bowel. And that 2 meters is not going to absorb anymore. And we're going to put a connection with your gastric pouch, and then the food that you take go directly to your new reroute bypass or intestine. The expectations here is only slight decrease the ghrelin. Why? Because as you see in this picture, we don't remove the rest of the stomach. We only cut and exclude, but we don't remove the rest of the stomach. So it's going to be there. Increase the levels of GLP-1, increase levels of PYY, and the GIP decrease, especially in diabetic patients. Here, the comorbidities, it's going to be better, like hypertension, diabetes, cholesterol, arthritis, PCOS, all that is going to be better in this kind of procedure. That's why it's also called metabolic procedures. So the PROS is a gold standard because was the first kind of surgery for weight loss. So it's it's like the oldest procedural surgery. That's why it's the gold standard. Improves the obesity related to comorbidities like diabetes, hypertension, blood pressure, sleep apnea. And the cons here is the change of vomit and dumping syndrome and high risk of ulcers, the anastomosis or the connections. The duration approximately is like 2 hours. You will need to be at hospital 3 nights, and the recovery will be from 2 to 4 weeks. Okay, so talking about the gastric sleeve and the gastric bypass, both of them is excellent for weight loss. The weight loss on both of them will be almost the same. Okay, the percent is very, very low of difference, but obviously this will depend on what kind of medical history you have. So obviously not all the procedures are for all the patients. That's important to put all the medical information on your HQ. So another of the big difference is that in the sleep, we're not altering the anatomy in difference with the RNY or the bypass, that the anatomy will be altered. More the transit, the gastrointestinal transit. That's why in the gastric sleeve is a restrictive procedure, that because you're going to feel full more fast, and with the gastric bypass, you're not going to absorb all the nutrients. All right, talking about the mini gastric bypass, is a modification of the RNY. The weight loss of both of them is the same, because we also exclude 2 meters on the mini gastric bypass, and we make the same connection. So here in the mini gastric bypass, we divide the upper portion of the stomach to a tube like a pouch, which hold only 4 to 6 ounces of food. So the intestine is looped to connect with the new stomach to decrease the amount of calories that you will be absorbed. The expectations is to reduce the feeling of hunger through the altered gut, early satiety or feeling of full after small portions, reduce the calories and nutrients absorbed. Results the comorbidities like diabetes and the others that we also call. So the process single anastomosis connection, only one connection or anastomosis. That's the only difference between the RNY or the classic bypass and the mini bypass or OHGB, or one anastomosis gastric bypass. So it's safe, it's effective, and shorter procedure than the standard bypass. And one of the most effective surgeries to reverse failed gastric sleeve and lap band. And the cons here is the change of vomit and dumping syndrome, has risk of ulcers and change of bile reflux. So if you, it's very important that the bile reflux or the gastric reflux have a lot of factors. So it's very important to put all this information because we need to know is if related to the diet, if related to hiatal hernia or another kind of conditions uh, like sclerosis or gastric, uh, some gastric pathologies. So the duration here is 2 hours approximately, and the hospital night you will need will be like 3 hospital nights, and the recovery from 2 to 4 weeks. So what kind of bypass will be the best? The most important here is that if you have or don't have gastric reflux, a severe gastric reflux, not related to a hiatal hernia or a diet or something like that. So because if you suffer from reflux, the best procedure will be the RNY, because the other connection of the RNY is for that kind of people or patients with that kind of pathology of reflux, because we're going to cut and make another connection to prevent that the acid reflux or the gastric reflux will go through that to the stomach again. So but the connections will be the same for the weight loss, excluding 2 meters, and the resolutions and weight loss of the weight loss and resolution of comorbidities will be the same on both of them. Okay, talking about the duodenal switch or SATIS, is one of the more higher risk and with more duration of the procedures, because there's going to be more connections in this kind of procedures. So it's only to select some kind of patients. The duodenal switch surgery, also known by bilipancreatic diversion with duodenal switch, is a powerful weight loss and metabolic surgery. The expectations here is patient lose between 50 and 80% of the excess of weight in the first year. A high percentage of duodenal switch patients with type 2 diabetes are cured after the surgery, but here the malnutrition is a problem with the DS, and vitamin is not after surgery. So patients with gastric bypass and duodenal switch will need to take from long term your vitamins, your proteins, and following your with your physician to make some blood tests to prevent anemias or iron deficiency and all that. So this kind of, because it's a malabsorption procedures. So here the pros is up of 80% of the excess of weight loss in the first year. The stomach is, the size is reduced, high metabolic effect, and highest expect of weight loss. The cons is extremely strict vitamins required for life and higher risk than other bariatric procedures, because if you see here in this picture, we need to do more cut of their stomach, more cut of the gut, and more connections or anastomosis here to reroute all the food intake. And obviously more risk because the duration is from 3 to 4 hours. We'll need 3 nights, and the recovery from 3 to 6 weeks. All right, like I already talked, the PCOS or polycystic ovary syndrome. Here the surgery, bariatric surgery, showed to improve and reverse metabolic syndrome in women with PCOS, reduce the symptoms, and help restore normal ovulations. Why? Because obviously all your hormones go normally again. numerous weight loss surgery patient of MBC or Mexico Bariatric Center with PCOS have been cured and overcome infertility, and that's one of the most uh, notice that we more happy to us. Okay, how fast can the patient can return to work after bariatric surgery? It will depend on what kind of activity do you do. So if you're sitting in or office and you have a gastric sleeve, you can go back 1 week later. So if you have an RNY or a bypass, so from 1 to 3 weeks, a switch from 2 to 3 weeks, and gastric balut almost immediately. But you know your body, you know how do you feel to go back to your work. We only make some recommendations, and the most important here is the lifting. Okay, so if you make some work of lifting, we suggest from 4 to 8 weeks. No, even if you have the gastric sleeve, the bypass, or no switch. Okay, so why is this? Because it's to prevent that you can have some injury on your abdominal cavity. You're going to feel little weak the first days because of the liquid diet, but every hour, every day will be better and better. And once you can return to make some exercise and recovery all the strain in your force. Obviously, the recommendations are on the world. They bring their wear a mask, the social distancing, the test prior travel, and the vaccination. This is optional.
Yeah, well, thank you, first of all, for sharing all that information with us and our, future patients, our, people who are participating. But I want to mention that we see more and more of COVID cases. So please do test before you come, yourself and your companion, and be cautious, in the airport. Just, it never hurts to be more cautious, not to catch or give it to other people. It's very important. And for some reason, the cases of COVID are going up, and we see the people who are catching it, they're actually not doing too well. Okay, so just a few words about financing. Our packages are very affordable. You can pay the deposit, and the final payment is not due until 15 days prior to the surgery. And at that time, if you bring a cashier's check, send a clear picture of the check, or if it's cash or however, credit card, just let us know. But you have to be somehow paid or be accounted for. This prevents any confusion. And I want to make another brief explanation of what's happening. What we do is not simple. We, for example, Hyatt, like I said, they charge me over $200 for staying there if it's not reserved prior. So the coordination of all this with the drivers and hotel, hospital, the surgeons is all very, very complicated. And we do this that makes your life easier. So please do not reschedule last minute or no show up, or just, because the driver is waiting for you. The hotel is reserved. We do all that for your convenience. And just make sure, you communicate with us ahead of time. If there is some problem, just let us know, at least, give us more than 3 weeks to make any changes. Back to financing. If you were to finance Please do not apply to too many places at one time. It's gonna hit your credit score. But there are options on our website you can go through, or you can go through your bank, which you have if you have a good relationship with them. There's also SoFi. Credit unions are also great places to look for. Doesn't have to be a medical loan. It could be a personal loan. Okay, why MBC? We offer another piece that it puts you at ease, puts your mind at ease, is what we call medical tourism complication coverage, and for short, MTI. This is offered to you at $149. This is exactly what we have contract at a high volume with this insurance company. We basically take your money and give it to them so you can have the best savings and have coverage for complication, for loss of, additional expenses due to the complication and things like that. And look at that very carefully, and I advise you always buy that. This is the only company covering this for so cheap. Again, the vitamins are crucial for all type of procedures, sleeve, bypass, DS is even more, right? Like Dr. Montalvo mentioned. So you want to take a high quality with the right, the sugar content is very important. The nutrient contents are very important, and Emerge is one of the best products out there. You get actually what we call the MBC care package. You make sure once you get that email, you act on it. So you pay for the shipping handling, you get a month of free of the vitamin. This is only for US patients. Outside of US, because of shipping handling prohibitive, we don't offer that. But then take advantage of this MBC. So at this point, I want to launch the Mexico Bariatric Center webinar poll. And like I said, you should be getting, all of you on Zoom, you should be getting the poll. People who are on Facebook, just a moment. Okay, so I see you guys already filling up the Zoom poll. Please make sure you do that. That's one of the requirements to enter the raffle. Unfortunately, we couldn't do this for Facebook participants, so you have to be on Zoom to participate in the raffle. Maybe next time we can do something, but yeah, so only people on Zoom can do the poll. So if you didn't hear your questions, the answer to your questions in the presentation, you can still add it to the Q&A tab, and we'll try to answer as many as possible. And then we do our drawing. I still see people are filling it out. Please go ahead and do so. And we're going to start just answering some of the questions. And meanwhile, I show you some of the before after pictures. We have thousands of these pictures. And okay, so let's go back to the questions. Yeah, so unfortunately, we cannot do the poll on Facebook. I'm sorry. Okay, so that's a question for you, Dr. Montalvo. Holly is asking, what do you recommend for someone who may be dealing with food addiction? Would the surgery help this?
Okay, Holly, and all the patients. The most important here is if you're going to make the decision to come with us and make a change, our surgery, this is only a tool for you. You will need to make a change on your diet. You need to make some exercise. If you want to have some 100 success with all of this, it's very important to make this change on on the food that you will take. So uh, if you want to go forward uh, and you decide, you will need to go with a psychology therapy. So you make these changes first in your mind, and then we're going to help you with the kind of the diet and everything about the gastric procedure, removing all this ghrelin hormone or excess of your stomach and everything. But you will need to make this the first of all you need to put all these ideas on your mind, and then we can go forward, because it's very important to make these changes.
Okay, Buffy is asking, if you already had gastric sleeve over 8 years ago, can you still have SADI surgery right now? And is it safe if you still need to lose 55 to 60 more pounds? Would that be the best option?
Obviously, the on the put all the your medical information on the HQ, your surgery that your interest, and I believe we're going to check it, and we're going to make the recommendation of the best procedure for you.
Yeah, perfect. Yeah, so it's important to put all that information in your health questionnaire. And now, one thing I want to ask a question, so they always say, oh, SADI and DS are very aggressive, even bypass is very aggressive. But look at long term, right? You want to look at what is the long-term solution for your situation. I just read an article that was a 15-year out study, the difference between bypass and SADI and DS surgery. That it's 15 years after the surgery, DS duodenal switch has the best results for losing weight and comorbidities and keeping it off. So you have to remember, your lifestyle is also important. Like this last patient asked, what is the food addiction and all that. So you want to make sure the surgery you're getting also matches your lifestyle. What you're capable of doing, your age. As we age, it's harder to lose weight. Yes, duodenal switch is more aggressive, but we may need it because of what it does. Okay, so that's what I was talking. And if a center or a surgeon cannot do DS and they're the standalone company, guess what? They're going to give you sleep, and that's not going to be doing it for you, because of all the acid reflux, this and that, all this stuff we were talking. Actually, Buffy is still asking, if you have a sleep and you develop acid reflux, would SAD help?
Yes, the study will help because there's not going. First of all, we're going to make a lot of connections there. So, but the other and most important in the study is that there's not going to be any more valves there that can make your suffer from reflux. So the study is have the both the both functions restrictive and malabsorptive. So you're not going to first you're going to have more satiety and you're not going to absorb all the nutrients, and obviously this will help for you. And then there's a lot of um, like anatomic changes that we can make over there for the reflux too.
Okay, so how long does it take after we fill out the health questionnaire to get an appointment? So basically, depends on the weekend or not. Usually within 24 hours, you should hear the surgeon has reviewed your health questionnaire. They have an answer for you, and you get an email say, hey, congratulations, most of the time. And sometimes they ask for a little bit more information. But usually it should be a day or two. Depends again, if it's a weekend, it could be one couple days more or less. Okay. But you can always call us. Our office is 855-768-7247. You can always call us and somebody will answer you. How can you get a spouse on board with getting the weight loss surgery? He doesn't see anything wrong with the way I look, but I am 240 pounds over. I need a change. I'm a mom of two, can't do anything because of the weight I have. Yeah, so it's very important to have support from your loved ones, whether it's your spouse, your, your people you live with, significant others, parents, you name it. Even if you're older, your children. As general rule, you want to be. So basically, this surgery helps you not only live a healthier life, but in general, I heard Dr. Montalvo can correct me, it adds an average of 8 years to your life. Again, more or less. It could be 10, 15, but you live especially when you have kids, you want to be able to play with them. You want to be able to participate with their activities, be out where they are and be an active parent. And when we are overweight, the fat, the extra fat is pressuring all of our organs, everything. It affects us emotionally, physically. And if this tool is available, look at what MBC has done. They have made this procedure, the process so streamlined. Our surgeons are awesome. Very little risk for you to go get the surgery done with a little money and come back. I mean, this is available to you. And, but, so that's my 2 cents on this. Jamie, somebody asked you, Jamie, are you still around?
I'm on. Yep, I'm here.
Yeah, Kara is asking, how many medications are you on? Are you still losing hair?
Oh, yeah, that's a great question. So, in a few of my lives, I have noted that I was not great with my vitamin regimen I got with our new nutritionist here. And I am on the Emerge vitamins, and it helped instantly with my hair loss. I thought I had that under control, so I really recommend anybody, if you think you got this, you probably don't. You start feeling good and start losing that weight, and you think you're just like, way to go, I did it. But I was just taking like, store brand vitamins, a woman's multivitamin. It did not. I took biotin. I paid hundreds of dollars for stuff from like a cosmetic place, and it didn't help. But the iron in our chewables are great. But also, you know, basically getting on those vitamins right away helps. But other than that, that's all I can say about the hair loss. It's a thing. It does pass if you do stay diligent on those vitamins. And what was her first part of the question? I'm sorry, Ron.
She asked if you're taking any medications on a regular basis.
I am on only one medication because of my weight gain, partially was attributed to steroids. I was on prednisone for 4 years because of my rheumatoid arthritis. And I was on high blood pressure and a bunch of things. I'm not now, but they control my RA, my rheumatoid arthritis, with Enbrel. It's an injection once a week. And I only take the Emerge chewables and the Emerge calcium chews as well.
Thank you so much. I appreciate that. So, Dr. Montalvo, they're asking what gastric sleeve method is used if one is to book with you.
I think it's the endoscopic or the classic. I think you refer to that.
So maybe
She's
you
talking about that.
yeah,
The,
yeah.
the classic, the 5 incision. Well, at least with me, I only make from 3 or 4 little incisions of 5 millimeters. So that's the sleeve that you will have if you book with me. Not
Now,
very tight.
what size of bougie do you use?
It's 36 French.
So thank you so much. Yeah, I wasn't that clear what. So that Anna is asking, what is the percentage of successful patient to unsuccessful patient? I don't know if you want to answer that or.
Well, it's supposed to be all of the patients will be successful, but like I already talked, this is only a tool, all right? So if you want to have the 100 success, first one, 33% will be the surgery. The other 33% will be the nutrition plan or a nutrition follow a nutritionist, and the other is to make some kind of activity. So obviously, if you have for example, if you make your surgery, but you don't follow a nutrition plan and don't make any kind of activity or exercise, you're not going to have any success. So this is only how we're going to help you, but the rest is on you to make the other changes.
Yeah, so I have something to say about that. In the books you read that 15% of patients are needing revision or they're not successful getting to their goal weight. I would say from our patients, I would say 5%. And I know the reason. It's how much you know about the type of surgery you're getting into, how dedicated you are in the pre-op, your lifestyle, like Dr. Montalvo said, how do you adjust your lifestyle? And so you read like, okay, gastric sleeve, you can lose 65% of your excess weight. But look at Jamie. Look at so many of our patients that they've lost more than they've lost all their excess weight, which is more than half of their weight. So there is no limit. This is like Dr. Montalvo said, this is a tool you're acquiring. How do you use the tool? How much know about the tool you're getting into? What is your dedication to this surgery, and what do you do with it? So if you ask me, it's like you can lose all your excess weight and you can keep it off forever. So that's that. So if the patients are not successful, now if we're talking about like maybe they experience, you know, GERD or acid reflux, they have to get a revision, that's a different story. But as far as weight, I mean, you should be able to lose your weight if you get the right surgery for you. Oh, that's a good one. How long should I stop Ozempic or GLP-1 or semaglutide medication injections before surgery? I would say at least 2-3 weeks, because what happens is it has a gastric, it slows down your gastric emptying, and even if you do your diet, pre-op diet, you still have stuff in your stomach, and that's not good for surgery. So stop at least 2-3 weeks before surgery. How about insulin? How long before surgery they have to stop insulin, Dr. Montalvo? Or do they have to stop?
The insulin needs to stop once you start with your liquid diet.
Okay, so 2 days, 2 days prior. Okay, so the hotel in San Diego is Hampton Inn by the airport. That's the one. Okay. Okay, so now that's actually a good discussion. Let's say you cannot get a flight coming in before noon, like we asked you. You can come the day before that and stay in Hampton Inn and then get picked up. So that way you can still go before 1 o'clock, before 12, I mean, get picked up. So the same thing goes when you depart. Let's say you cannot get a flight, maybe you can get a flight at 9 p.m., right? So it's you don't want to wait from we usually get you 2-3 hours prior to your flight. So you'll be waiting like 8 hours, 7 hours, whatever. So you may want to stay that night in Hampton Inn, and then the next day take the shuttle, go to the airport, and there we go. So okay. I just wanted to mention something that I saw the other day, a very known surgeon that works by themselves, and they're trying to imitate our webinar, and they said, webinar for revisional surgeries. Okay, if you hardly can do bypass, how could you talk about a revisional surgery? This came to my mind when I was talking about SADI, revision, and mini bypass and bypass. So just be careful, they can't even do a bypass. And how could you do a revision not knowing bypass or DS and all that? So anyways, yeah, another patient says, I really, really need DS, but have acid reflux. If I have a hernia that it's fixed, could I be able to get DS? I'm okay with RNY if need to, but prefer DS.
That's a very important question. That's why you need to put all that information on your health questionnaire. And the other thing, there are the two opposites. So once we go in your abdominal cavity, it's very evident that the hiatal hernia, and in all the cases, it's very important to repair it, and it will be repaired. All right. So it will depend of the case. So if you want to a DS and the surgeon found the hiatal hernia, he will repair it and make maybe the DS and or make some changes, cut before the gastric valve to prevent the reflux. I don't know. There's a lot of changes that we can make, but yeah, the the reflux have a lot of factors. Some patients, even with the weight loss, the reflux go away. The changes, the diet changes, uh, make some uh, uh, very good for the reflux. It have a lot of factors.
So they're asking, so are you doing general anesthesia for your sleep?
Yes, for all the procedures, the anesthesia is a general anesthesia.
Dr. Montalvo pretty much explained what is the recovery like. So what you want to do is after your surgery, don't lift heavy weight, wait for high, intensive workout, listen to your body, give your body time to recover. Of course, you can walk, you can do work, but just gradually, take it. So if you feel exhausted, stop, Um, so again, we talked about smoking, we say 4 weeks, but do the best you can. It helps you a lot before and after, just do your best. Remembering that how it can help you, okay? So for TOR procedure, I think we do 1 night, but sometimes 2 nights because it's basically endoscopic, so it's a fast recovery. Yeah, so if you have an HQ in our system, no matter who the surgeon is, again, if you win and we have to switch you, those are the only procedures that Dr. Montalvo offers. So you have to know that. But we could switch you. You have to attend the webinar to the end and also make sure you did the Zoom poll I sent you, okay? Those are the requirements. I believe Canadians can bring money order or again, cashier check is the best way. You send a picture of 15 days, say, here's my money, and bring it with you. They collect it on the day of your pre-op. Okay, so, yeah. Do I need a passport? We highly recommend a passport book or a passport card. This, basically, you make sure that you're sometimes, most of the time, you're in a van with other patients crossing to US. And if sometimes you get that one officer that is very strict and you don't want to have any questions, just keep your medication out, have a passport, so you can have no problem crossing, you and your people in the car, in the van. This, they're asking if you give them heparin shot before flying.
Yes, we put some blood thinners once we finish the procedure. And um, we, to all the patients, we have a protocol. I think there's like two shots on the package every 24 hours, but and that's the that you will need. uh, if your flight is too long, we make some recommendations to put your compression socks, to walk every hour on the plane, to keep moving. But with 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 that, it will be okay. There's no problem.
Can you explain dumping syndrome?
Okay, here the dumping syndrome is more patients with bypass. And why is this? It's because of the diet. It's because you eat some food that you don't need to take, and that cause some changes in you and your is going to make you to feel bad. So we make some recommendations on what kind of food you don't need to prevent, you need to prevent to take. But here is more that the patients know their bodies, and they will be related what kind of foods they don't need to take, or make some change on your glucose.
Um, Now they're asking about skin removal. So we do have our sister company called Mexico Cosmetic Center. You wanted to start looking at it, but at least wait 1.5 years, 1 to 1.5 years to go through cosmetics, because that's what your body needs to recover. And that's when you come to us. We have board certified plastic surgeons that are specialized in post-bariatric patients. That's very important. Not every plastic surgeon can handle them, but come to us, Mexico Cosmetic Center. We will get you with our best surgeons to explain what the process is. Yeah, if you had to have a tummy tuck before, there's no problem. We can still do the surgery. There's a lot of questions about PCOS. There was one question about GLP-1 medication that she said she's lost not very much, but the surgery is definitely going to help you. Again, remember, surgery is giving you restriction, malabsorption, and is giving you all the hormonal changes. So it's a lot is happening when you go through the surgical intervention for obesity. So, so we do your FMLA paperwork. I've been trying to see what email you need to send it to get it processed, but you can ask your coordinator. I think Kelly is in charge of that. Okay, so, all right, so I have the list here for, well, there are more questions, but we're getting close to 2 hours. I don't want to keep everyone waiting. If you have had question and we didn't get to answer, please reach back out to us and we would be more than happy to answer it. But I have like so many left to answer. Okay, so here's the list of people who qualified to get the $2,000 off of raffle. I will just pull one name out. Amber Alvarez. Amber Alvarez. Let me see if I can find you here. Amber Alvarez. Yep, there you go. I'm going to let you talk, Amber. Just tell us about yourself, which city you are from. Tell us more about your weight loss journey. Hello.
Hi, I'm in Phoenix,
Okay.
and I've struggled with my weight since I was in my 20s. I lost, about 60 pounds about 5 years ago, but then I gained it back with some hormonal issues. And, ever since then, it's been a struggle. I tried Ozempic and the semaglutide, and it just, didn't work, didn't make me feel great. So I've been wanting to do this for quite a long time.
Perfect. Is this your first time you submitting a health questionnaire, or you had one in our system before?
No, this is the third time that I've attended this seminar.
Oh, okay, okay. Well, congratulations. We will get you all squared away. I don't know who's your coordinator, but they will contact you to get you on the calendar. I will,
Awesome.
yeah, well, thank you so much for you and everyone else that they took their time and joined us this afternoon. And Dr. Montalvo, we appreciate you, all that you do for our patients, for us, and taking time today to explain. Thank you, guys, and we see you next time in September, okay? Take care. Goodbye.